Hello and welcome to Health Bytes. Health Bytes is a new initiative brought to you by the Public Health Unit of the Ministry of Health and Social Development, and it is an initiative to educate, to advocate, and to inform the community regarding health. Today is our first program, and our topic is disaster management and the hurricane season. And I know a lot of you don't want to hear about the hurricane season right now, but we are in the peak of the season, and this is definitely a conversation that we need to have. So we have with us on our panel today for this discussion, we have Patrice Maduro, and she is our public health nutritionist.
Thank you for having me.
The pleasure is mine. Next to her, we have Ms. Harmonie Massiah, and she's our national epidemiologist.
Good day, everyone.
And we all know her face. And right next to me, we have the Deputy Director of Disaster Management, Ms. Sheniah Jones.
Good day. How are you?
Thank you, ladies, for coming on the program today to talk about this very important topic. And, you know, we can't talk about hurricane preparedness without reflecting on Irma. We're coming up on 4 years since the impact, right around the corner, and that's why I guess we're so adamant about having this conversation now, because we are in the peak. So just let's talk a bit about, you know, some of the lessons that we learned from Irma that will translate into more or better preparedness for us right now. Ms. Armstrong.
Oh, thank you for that question. In terms of lessons that we learned from Irma, I think personally for me, two of the major lessons that I learned is that in disaster management, we plan for worst case scenarios. But with Irma, we realized that some scenarios are unthinkable. And that's exactly what happened with Irma. No matter the worst that we could think of, it was not as bad as Irma became for the territory. So that's the first lesson. Some worst case scenarios are unthinkable. And the second lesson that I learned is that material possessions are irrelevant. Once you have your health, once you still have strength, positive mindsets, and God's grace, you will be surprised in terms of what you can accomplish.
Definitely.
And those are the two main lessons that I hold on to, considering that all we've gone through with Hurricane Irma and also her cousin Maria.
Definitely. Ms. Massiah?
So what I learned personally is that you can never be prepared too early. From the time we enter the hurricane season, we start stocking up on supplies, we started ordering the waterproof containers, you know, we started getting all these little essential things in the event that something catastrophic may happen, because you know it's been forecast that the hurricanes are going to get worse, especially due to global warming. So we were trying to be prepared for that eventuality. Another lesson that I learned is that it is actually good to have a sense of humor and a positive mindset, even during the worst. I remember when we were in the closet, it was my mother, my baby sister, and our 5 dogs that would not stop fighting for dominance. Even everything around us is literally going haywire, and they're behaving the fool in the closet. And we have like those accordion doors that we love here in the BVA. So I am there in the front holding on to the doors to stop them from opening, and we could just hear the debris hitting the roof, and it just looked like there was just something hit the roof at the right angle and just peeled away like an onion. And all of a sudden, I'm looking through the slats, and you could just see clear blue skies. And a couple of seconds later, I just see my mother's little round head peek out from between the clothes, and she comes over to the doors, and she's looking up through the slats. So she's like, I had never liked that roof anyway. And my baby sister is in the back. Really, mommy? Really? And after that, it's like just the whole tension kind of
Release,
a little bit, and we were like, yeah, we're going to make it, not just physically, but psychologically as well. And sometimes you need those little breaks to kind of reset and kind of encourage you to move forward.
Wonderful story. Ms. Maduro.
Well, for me, I don't know if you would say it was fortunate or unfortunate, but I wasn't here during Irma and Maria. I was actually in the UK. But I remember Hurricane Hugo in 1980. 9. I was 4 at the time. Hold on, I'm telling my age now. But then I remember the destruction of Hugo, and I couldn't imagine anything being worse than Hurricane Hugo until being on the outside and you're looking at all the devastation that was caused by Irma. And I could remember, trying to get in contact with my family, but I couldn't because everything was just dead. I remember feeling that sense of hopelessness and being lost because I'm like, oh God, remember what I found, I can't find it. That kind of thing. So for me, it was like never say never, that kind of thing, because you always have to have that boy scout or that girl scout mentality, always being prepared. So for me, during the hurricane season, I was always thinking, being in that mode of preparation, being prepared for the worst case scenario, as worst as you can think of, because honestly, I never thought that something like Irma would have happened here. And I think a lot of people didn't think that something at that magnitude could have come to our territory, because hurricanes, we're accustomed to hurricanes, and so we're like, oh yeah, hurricane, we got this, yeah. Been there, done that, happens every year. But I don't think we ever thought this type of destruction could have come here to our territory. So for me, that lesson of always dotting your I's and crossing your T's, making sure that you're absolutely prepared. For me, that's one of my takeaway lessons from that.
Yeah, definitely. And just to share a little bit about me, I did go through Hugo. I did go through Hurricane Marilyn and St. Thomas at the time, where that was kind of devastating. We were shut down there for months. I even came up here and started to go to school with my cousin because we were out of school for months. And then now you meet Irma. And it's like you said, the likes of nothing like we've ever seen before. And it was heartbreaking, especially for me, looking down on the community that I live, because I live up on the hill, and all my family live on the flat. And when we came out during the eye of the storm, I was like, oh my God, everybody dead, because it's like all you were seeing were ocean, like was the ocean. It's like, oh God, I wonder how my family, you okay up on the hill, but everybody down on the flat, you were really worried. But I think once we got out and we walked from Eastern to Western, or from King Garden Bay to Long Bay, to look and to check on our family, and we realized, like, wow, all this devastation and we still here. Yeah. I think that was the hope in everything. I think that is what propelled us to have that good that mental state about what was going on. We were out of power for 6 months. We didn't care because we know we are alive, and it could have been a lot worse, and everybody was just so grateful. And to me, I would take that away, just being so grateful and living in the moment, and like you said, being prepared. I know now that since Irma, since Maria, we have a lot of issues, although we were all grateful for being alive, but we have a lot of anxiety issues. And even with this little storm that passed, I saw somebody joke on Facebook that, tell me when it passed, because I need to come up out my system. I was like, you've gone in your system for a little storm. Sheniah, talk to us about some of these issues now that we're having with this post-anxiety to the hurricane season, and is there anything that we could do to allay some of those anxieties?
Well, you're very correct. What we're recognizing is that because of the trauma the community has experienced with Irma and Maria, we're suffering from post-traumatic stress in a way. And the only way we can really get through that and get over it is to face our fears. The only way we can get over it is to talk about it, the conversations that we're having, speaking to persons. What was your experience? What was lessons that you identified? And not just identifying lessons, but putting those lessons into practice, right? We know the roof wasn't secure. Are we going to rebuild? How are we going to rebuild? What are we doing differently? Are we doing hurricane straps? Are we doing the cast ceiling? How we rebuild, are we going to be putting those lessons into place? Where we choose to live, we're going to be putting those lessons into place, because we recognize some places are safer than others.
Yeah.
So we recognize that you are afraid, you are still apprehensive, but everywhere you go in the world, there is some type of hazard activity that can impact us.
Definitely.
So the best thing is, what can we do to prepare ourselves? We still suffering from post-traumatic stress. Let's talk about it. Let's have a conversation about it. And let's set a plan into motion on how we can help ourselves, help our communities to do better, right? You learn all these lessons, you can't just sit down on them. Let's put them into place. Harmonie spoke about early preparation. Hurricane season starts June 1st and extends to November 30th, right? What are you doing to be prepared during that time period? Are you stocking up? Have you identified around your home what are those things that can be used as projectiles? Excuse me. Are you trimming your trees? Are you securing those things in the yard that need to be secured? Did you change out your windows to impact-resistant windows, or did you install hurricane shutters? It's all well and good that we kid about it, and we're still traumatized, we're still suffering from it. But what have you learned, and are you putting those lessons into practice?
But it isn't just individual lessons, it's lessons as a community. Because I think right after Irma passed, I think the outpouring of support and love from the community was unprecedented. I mean, because literally my house pretty much caved in, had persons from the community that came out into my house to try to get us out as well. And they had some really great men in the community, like Skelly. That I'm talking about, literally the next day, Skelly was on the road with a backhoe and he was clearing and he was moving stuff, and the people came out and they were helping him, and they were helping people clear their yards, and they were out bringing food to other people who didn't have any. And I think all of those, that outpouring of love and support actually helped some people survive mentally, like it assuaged their fears. And I actually think that is why a lot of us psychologically and environmentally and otherwise are in a better place now, simply because the community came together afterwards and helped each other. But after a couple of months, you kind of saw that fell off. Yeah, we kind of went back to
life as normal.
To life as normal, behavior as normal, and persons that still need our support. They're still struggling.
Definitely. Well, Harmonie, I know I've seen you many times, talking about COVID, and we've recently had this surge and this massive outbreak in the community. We're battling COVID. We're in the peak of the hurricane season. I mean, pick a disaster. How can we balance trying to follow all these COVID protocols and making sure that, we don't extend this current outbreak? We had news that a case of Delta was confirmed in the territory, so it very well may still be lurking here. You've preached over and over about, the kind of destruction that a Delta outbreak could have on a small-knit community like ours. So we had thinking about COVID. We're in the peak of the hurricane season. I mean, how do we balance that? And where should our focus really be?
Miss, before I answer, would you consider the COVID-19 pandemic to be a disaster? Like, definition-wise, does it fall underneath the umbrella of what a disaster is?
Oh, definitely. When we think of disasters, we think, traditionally that your home falls down, right? But COVID is lurking or beginning to become an economic or a financial disaster, right? It's becoming a health crisis. It's becoming a health disaster. So yes, COVID, based on the numbers, we have from the previous outbreak, we had 36 persons that perished, right? Before we had one. So now our total is 37, right? For a small community like ours, that is devastating. That is families that are impacted, that are friends and co-workers of these individuals, right? So that is devastating for the community. So the community still has that in the back of our minds. We're dealing with COVID, we're in hurricane season, God forbid something else happens. Right. Before Harmonie jumps in, I just want to segue into what we've seen with Haiti. with our Caribbean brethren.
Yes.
They just experienced another 7.2 earthquake.
Yes.
Right? So there are thousands that perished. There are hundreds of thousands that are homeless. Right? On top of that, Grace that passed through was at Tropical Storm Strats and brought a lot of flooding and further erosion and mudslides to the area. And they are still battling COVID. Right? So that's a multi-hazardous situation.
Wow.
So it's something for us to consider and think about. How would we put ourselves in that position? How would we react? How would we recover? So sorry for jumping in, but
No.
yeah,
That's
Yes, because
Yeah.
we think people don't usually really see COVID-19 as a disaster.
Yeah.
But they need to understand that a disaster is anything that kind of overwhelms the
Yes.
capacity or the ability of the country to cope using its own
Resources,
resources.
yes.
Okay, so COVID-19 definitely falls into that category. And with the upcoming, well, we're kind of in the midst of it now. If anything happens to further undermine our economic or our health infrastructure, we definitely are going to be looking at an increase in excess deaths. Okay, and we're actually starting to see it, but because now we're having there's still many surges. Every day we're getting new cases, new community cases. Okay, which means again that we still having is an indicative of ongoing community spread. All right, with waning immunity, it means that you can get reinfected. Okay, which means that increases your chances again of becoming severely ill, which means you might have to be hospitalized. So therefore, every time that you have somebody that is hospitalized from COVID-19, is actually a bed that's being used for persons who still have like the chronic conditions and the other healthcare conditions that need to be seen and treated. Okay, and then when you if we have a catastrophic hurricane and devastation of houses, you're going to be looking at persons who are going to be pooling with other persons in their households. And that again, that close contact is a recipe for another outbreak.
And just to jump in with COVID, what is so different as we're recognizing pandemic, we haven't really experienced that in living memory. And with the pandemic, it is so different from other hazards in that ever so often there's a surge. And then we scale back and we kind of go back to normal, and then there's another surge. So we can't really predict when the end of this pandemic will be. And we have to be constantly prepared for those surges. And with those surges, it puts us into crisis mode. It puts us on the verge of declaring a disaster because we would have had, like Harmonie said, our resources being overwhelmed, having to beg other. Pardon my having to call on our Caribbean neighbors for assistance, having to ask them for vaccine doses, having to ask them for health support or health services. Can you assist us with doctors, with nurses, with testing? You know, that is exhausting the resources that we have. So with the pandemic is a little different from other hazards that we would have seen, because ever so often we have to go back into this mode of crisis and response, and the community isn't really getting that time to recover.
So then how are we, or what advice do we have for the community to make sure that we are ready on both fronts? What tips can we share?
So if we're looking from a structural point of view in terms of hurricane preparedness, I mean, we could kind of take it step by step. Right?
Okay.
For example, how would you secure your doors and windows?
So looking at preparedness for hurricanes, we know that based on your construction, you can get the hurricane grade windows, you can get the proper doors, etc. If your home is unsafe, we recommend that you look at how or where will I go, or if there is a safe room within the home. Harmonie mentioned they were in a closet, Is there a safe room in your home, a closet, a bathroom, a room that doesn't have windows? That's where you would want to go. In terms of securing your windows, we can go back to the old-fashioned method. If we don't have shelters, we would want to put up the plywood, right? Those are the quick and easy methods to just batten down the hatches, so to speak. You'd want to reinforce your doors with something pushed up against the doors, because as we recognize, with Irma, those doors blew up.
Yeah.
Right?
Do you suggest that persons kind of like inspect their windows and reseal before the hurricane?
Oh, definitely.
And before you even answer that, what are you looking for when you inspect the windows?
Yeah, like, do we have like I know we have building inspectors, but do we have anyone that is like specialized for like hurricanes and stuff like that you can bring to your house and inspect to see whether or not it's hurricane proof or anything like that?
There are a number of local structural engineers that are available, that are trained, and that they do go out and assist persons in reviewing their homes, in just checking for structural damages and pointing out what can be done, what needs to be replaced. So there are a number of local structural engineers that can do that.
I think we'll need to put that out to the public. I'm going to hit you up afterwards as well, because Tropical Storm Grace, but I didn't like stormy weather. Despite Irma, whatever, I like the gloom, the chill, everything. I like stormy weather. But I don't like stormy weather if my windows are leaking. Water is coming in. So that's exactly, I was just on my bed, I got up, and I was like, why is my floor wet? And when I got to my window, literally the water was actually streaming in through, and I was like, okay, this is something that definitely needs to be addressed before we really get into the hurricane season. And, you know, I know after construction, after Irma, when they were constructing, they were putting in these hurricane-proof windows, these shatter-resistant windows. I don't know if those things work, because somebody was cutting their grass in a home next to mine, and a rock hit it and it broke. So I was like,
Wow.
I was like, you ripped off.
You weren't ripped off or robbed. Those windows, they do serve a purpose. As we recognize with the older type of windows that we have, the once it hits, the whole thing is gone. With this one, you still have those little bars across the windows. So it's still preventing larger debris from coming in. So that is its purpose. So it's not impact resistant per se. It is hurricane. You have to be very careful about these technicalities that exist for these things. So you have to be very careful. What are you looking for, and what are you hoping these windows to do for you? You have to go and read up about it to ensure that this is the product that you're getting. So we put in those little pretty windows with the bars across them, but it really is, once the window breaks, it's kind of preventing those larger debris from coming in.
Oh, because I was expecting more, because the guy was like, this can withstand winds of 200 miles per hour. Projectiles. I was like, you have
Yes. He's smooth.
What about the roof? What can we do? Because I've seen persons invest in the roof strats.
Yes,
Are
the
those
hurricane
viable things that we can actually do? Do they actually work?
Yes, you can invest in the hurricane straps. There are persons that they have moved to even like putting like a cast on the ceiling. You can reinforce the ceiling by ensuring that your ice and water shield layer is in place. That prevents the leakage. So there are a number of things that persons can do with structurally, construction-wise. So you speak with one of the structural engineers. If you can afford to, you have them come to your home and do a review, just do an inspection, and then they can tell you exactly what additional steps need to happen so that your home becomes a bunker, right? And you can feel safe in your property and in your home.
I wanted to piggyback on something you said earlier, Harmonie, with regards to the state of public health in the territory now, with our services being overwhelmed as a result of COVID and maybe some of the other diseases and chronic conditions that we are experiencing are not getting as much attention. You can't just walk into a doctor's office like that anymore. And as we're in the hurricane season and we have our nutritionist here with us, how do we ensure that the quality of foods that we have or that we're planning to have on hand, should we be impacted by a hurricane and significantly affected by that, how do we ensure that our health and our nutrition is maintained even at that time?
Well, first of all, what we have to understand under those conditions, you would not necessarily be able to get or to eat the foods that you should normally be eating. You might not get access to fresh fruits, fresh vegetables. If your electricity is gone for a considerably amount of time, that perishable stuff, that's a no-no. So the types of food that you get, of course, they would be higher in sodium. And if you do have high blood pressure or diabetes, end-stage renal disease, that can cause an issue. So it's that's where the preparation comes in, because you have to plan for these things, especially if you have some sort of health condition. You might have to look to see if the canned stuff that you get, they are lower in sodium. If you can't get, you might have to see if you can boil some of the sodium out of these things. Obviously, if you're an elderly person and you're shut in, we have to think about hydration. For the elderly, you will not be able to get a lot of these foods that you normally be able to get. So you have to make with what you have, to be honest. I'm not sure. I think Sheniah could correct me if I'm wrong. It's 7 days that you would prepare for, isn't it? Or
On having foods and stuff on hand?
yeah.
Yeah, 7 to 14 days.
7 to 14 days.
21 is ideal, given our experience.
Yeah, so obviously you would, the type of foods that you take would have to be able to last that amount. So perishables would be out of the question. So it's a matter of, and we'll get into this on another session, but it's a matter of looking for sodium stuff that isn't too high in sugar or too high in fat. So it takes it's a juggling act that you have to sit on and actually read to see would these things be benefiting me during this time. And if not, you have to walk around to see how can I doctor them so it wouldn't cause me any sort of further complications during this time or even after.
I like what Patrice said. How can I doctor them?
Yes.
So it also places an onus on the individual.
Yes.
Yes, we may not have access to fresh foods at this time or for a duration. The only thing that we do have is canned foods, etc. How can I become more creative with this so that it does not impact my health? Right? And the onus would be on those individuals to research and just look at recipes that they can use.
Definitely. And I was just thinking, keeping yourself informed. So now, as a Deputy Director of Disaster Management, I would like for you to share with us basically what's going on with the forecast for the Atlantic season this year. And, what's the real probability of us being affected by a hurricane?
Okay, well, this year, we are looking at having an above average season. An average season would have 12 named storms, 6 of which can become hurricanes, 3 of those can become major hurricanes. With this season, we're looking, I believe it's forecast to have between 13 to 20 named storms, right? So that immediately tells us it's above average. The more storms that you have developing, there's a greater probability that those storms can impact land, so they can affect us, right? So what are we doing to prepare? We've been talking about that significantly for so far for the program. So individuals need to recognize this is the probability we can be impacted by storms this year. God forbid something happens again, but at least we would have been ready. We use multiple ways of communicating information to the public, right? A lot of it is electronically. We use the social media pages because a lot of persons are online, and our website, www.bviddm.com. We also have a DDM app, DDM Alert, yes. And DDM Alert provides you with the same information that we post on our social media. It's up to date, it's in your hand, it's on your cell phone. So you can go to the Google Play Store and download that app, or the iPhone store and download the app, right? Just be sure to turn your alerts on so that you can get the alerts when they come through. We also communicate the information via the radio station because not everyone is online, right? And internally, information would be shared via the Deputy Governor's office, just letting all public servants know this is what you need to do to prepare.
Right.
Further, we also maintain a list of disaster liaison officers with departments and ministries, just sharing information with them. And we're hoping to really branch that out to the wider private sector as well.
Definitely.
Because I don't have DDM's app. I have the app that the NOAA has. That's the National Oceanic and Atmospheric Administration one. And it's really... Sorry. It's actually really good. I've been using it to track our hurricanes and our storms and what's not. It's called Storm Radar, and it has like these overlays. So no matter where you click on it, it actually will tell you, what's happening in that specific location, and it will give you things like the wind, the temperature, winter weather, tropical storms. There's some features that you have to pay for. There's premium that I don't like. For example, like if you wanted to track where the storm is headed, or a weather advisory. But other than that, I think this is a good alternative, or another one that persons can have on their phone.
It is a very good and useful app. It has a number of unique features, as you mentioned. However, with the DDM Alert, it tells you exactly what's going on and what you need to do.
Yeah.
Right? So some persons may not be able to extrapolate the information from the other apps that they have, or they may be very excited with all of the access to information that they're getting. We have a lot of weather enthusiasts in the territory, right? But we also have to remember that with us, size does matter. We are a small territory, and it can work for our good as well as our bad.
Definitely.
You mentioned, Natasha, I think it was Hurricane Marilyn. When that passed, I think it was in 95.
95.
Maryland passed the BVI as well as the USVI, but the level of devastation was completely different, right? And that was basically because of our size. When we do forecasting, we look at the total dimension of the storm, and then also looking at those outer bands, how close it's going to be passing to the territory. Where are the pockets of thunderstorm activity, so that we know what's the average rainfall. A lot of persons would be like, well, Puerto Rico and St. Thomas, they're under flash flood warning, or they're under tropical storm watch. Why aren't we? We're like right there. But size does matter. The little distance that we are away from the storm makes a great difference, as we witnessed with Tropical Storm Grace when it passed through. It was impacting the USVI. It shifted south over St. Croix, and it was not a threat to us the way that we were initially anticipating because of that shift. So yes, there are a lot of very useful apps that show you all of the fancy data, the radar coverage, how much rainfall, wind, sleet, snow, everything. Right? But with the DDM app, we break it down to the bare bones. Here's what's happening, here's what you need to know, and this is the weather information. So it doesn't have all the flashing lights, but it shares information with persons as a quick and easy way for them to access it. So from that standpoint, I would say that the DDM's app is
DDM. I don't know why she come up on our program talking about that other app. I really.
Persons are watching this when you are trying to find out what's going on with hurricanes. That is the site they go to. They go to NOAA. And they look
well, now they're going to DDM.
They can go to both, but if you want personalized information, you look at what DBM is.
Don't worry, I'm a fan.
What exactly? Because I know you mentioned that the forecast is going to show an above average or very active season, with approximately close to 20 to 21 storms. And I know, and OO was saying you might get 3 to 5 of those storms that might, transition into a hurricane. What's the difference really between a tropical storm and a hurricane? And should preparations for any of them would be really different?
Okay, thank you for that question. When we look at weather systems that develop in the tropics, we're looking at tropical depression, tropical storm, hurricanes. What are those terminologies? It simply is looking at, we start off with a tropical wave or depression, and it gets progressively higher. So with a tropical depression or a wave, you're looking really at what are the sustained wind speeds, how much rain and thunderstorm activity are we looking at, what's the storm surge like. And with a wave, it's really, I think it was less than 38 or less miles per hour sustained winds, right? Then when we look at tropical storms are like 39 to 73 miles an hour sustained winds. You're now getting progressively worse in terms of the damage that you can expect, rainfall amounts, what storm surge you can expect. Hurricanes now goes up, I think it's 73 to 155, 56 miles per hour sustained winds, and we have a scale with hurricanes. It's a 1, 2, 3, 4, 5 scale, the Saffir-Simpson scale they call it. So the higher the number is the more devastation you can expect. So yes, tropical storms may not cause us, or you're looking at storm versus hurricane. A storm may not be heavily impacting based on the winds, but you also have to look at the associated rain activity. With us in the BVI, flooding is an issue.
Definitely.
So we still have to be mindful, not just because we hear a tropical wave or storm means that we just discount it. We also have to look at the rain activity. So I hope that answers your question.
What are their names, actually?
Okay.
I need...
You want your name up there? Hurricane Harmonie.
My best friend's name is Dorian, and he was very upset when they went and, created all of them, mash up the place.
with the Bahamas last year. Okay, storms get their names. There's a funny story in the past where naval officers used to name storms after wives, girlfriends, or politicians that they disliked. But the World Met Organization got together and they created a list, 6 lists of names, and these names are repeated every 6 years. So for example, the list for this year would be repeated 6 years from now. If storms cause significant damage and death, devastation, destruction, those names are retired and replaced by another.
So no more Irma.
No more Irma, no more Katrina. Those type of names have been retired. What we also recognize, I don't know how many of you would remember, is that I think it was last year we exhausted the list of names, and we went into the Greek alphabet. Last year, 2020, was a record-breaking year for storms. We had more storm activity than any of the other years previous since the records began in the 1800s. Last year had 30 named storms. This year we're predicting 20, maybe more. Right? So we still have to be mindful, and we still need to prepare and practice those lessons that we identified, start putting them in place.
Well, ladies, I'm not sure how many time has lapsed. Well, we are having fun, and we really need to bring this program to an end. I will give you each an opportunity to make your final thoughts. Sheniah, please make sure that you mention within your closing regarding the hurricane shelters. We didn't touch a bit about that earlier. And basically, I just wanted to say something before I give y'all this opportunity to make your closing thoughts. As we were talking about, the psychological impact, from Irma and, persons going into their system when they hear about a tropical storm. I was like, for a tropical storm after Irma, basically if you're not over hurricane category 2, you're not troubling me with that. I don't know if that's, after you sat there and you talked about, the rain and stuff, I said, okay, maybe I might have to tweak that concept. But after going to a Super 5, I'm not going in my system for a tropical storm. I'm not even batting an eye unless it's a 3 and above. But I know a lot of people out here, if the rain fall too hard, they're shaking. So bearing in mind all of that, in your closing remarks, just share a bit about, some comforting words and some motivational stuff moving forward that we could stay prepared for you, Harmonie. I want us to stay prepared for COVID. Because we need to talk, we need to wrap up with COVID and the hurricane season and how I could be prepared for both. And Miss Nutritionist down there, we need to talk about, making sure we're healthy enough to sustain, and just in case we have an impact and we can't get to all the foods and stuff that we need in terms of our people with these ailments, underlying conditions and stuff, because we can't afford to have our people dropping and dying anymore. So Sheniah.
Thank you for that, Natasha, and again, thank you for inviting my department to be part of this conversation. We didn't touch on emergency shelters, but the territory does maintain a list of shelters throughout the territory or throughout the different islands in which persons can seek safe haven. These shelters are not hotels, right? They're not purpose-built bunkers. They are identified to provide you a place where you can stay dry during a storm, and they can be used for any other hazard as well. So we advise persons that let the shelter be your last-ditch effort, right? If your home is unsafe, you want to go to, okay, can I stay with a neighbor, a friend, or a family member? And if you've exhausted all of those options, then you want to know where's the shelter that's closest to you. We traditionally publish shelter lists on the 31st of August. This is to allow an overlap with the years, even though the hurricane season begins on the 31st. A number of our community centers are used as emergency shelters. And following our 2017 experience, for that which shall not be named again, we recognize that the state of those facilities needed upgrading. So Ministry of Health is in a very good position right now in terms of fixing and updating those facilities. And for that very reason, I reemphasize that let a shelter be your last option, but you still want to go to the DDM's website, identify where's the shelter closest to you. Right, and you can call and contact us for more information. You can reach us at 468-4200 if you need additional information. So in terms of reassuring the community about this season, we recognize that it's going to be just as active as other seasons. With the possibility of more storms, there is potential impact for us. We still have time now. What the forecasters have said, at least for the next 5-day outlook, nothing is brewing. So consider right now, what do I need to stock up on? I would need to stock up on water. I would need to just go through my home and just take a picture of how things exist in the event that I have insurance, homeowners or rentals. You may want to look at getting updating your homeowner's insurance right now, or your renter's insurance as well, right? Pay attention to what's going on. Listen to the radio, listen to what's coming out from the DDM in terms of information being shared about weather. Weather is very unpredictable, and storms can develop when they're right on top of us. So best way to reassure and calm our community is to put the ball in their hands. Be aware of what's going on. Listen, look, read, and search. Download the DDM Alert app for additional information, and just be prepared. Know the steps that are needed. Secure your home, purchase the supplies that you need, and let's pray for the best, because God is good to us. Thank you.
Perfect. Thank you, Sheniah.
Okay. Thank you,
I
Natasha.
agree, God is good to us, but we may not necessarily be good to ourselves, and that is a problem. My closing remarks will be very short, because we're going to have another episode where we get talk about more about these shelters and the policies and protocols there, because they would have been adapted
For COVID.
Now, for me, COVID and hurricane combined, my thoughts are the same. We need more social responsibility. We need more social activism. We need persons to have more play a more active role in their health and their wellness, not just for themselves and their families, but to also look out for other persons in the community. You know, you have technical experts on the ground who went to school to study these things, who are giving you the advice and the knowledge free, right? And you should really pay heed to it, especially in these times. COVID is not going anywhere. Hurricane season is not going anywhere. So if we're giving or advising based on our knowledge of what is going on and situations are fluid, then the community needs to be able to be flexible, you know, especially mentally, all right, that yes, this was the information given a couple of days ago, but the situation has changed and the health, the persons in the field, they're coming forward and say, okay, we need to adapt, we need to do this now. And we need to be willing to say, okay, yes, we're going to do this now. And we have to be ready, ever ready to just be on our guard and to really do what needs to be done in order to stay safe and healthy.
And be ready.
That's the kid, that be ready.
And stay ready.
And stay ready.
Stay ready.
For me, before I get into the food space, I think that it's important for us to mentally prepare yourselves. You know, 2017 caused a lot of mental stress on a lot of people, and I don't think a lot of people have gotten over that as yet. So I think it's important to deal with that first. Talk to somebody. There's professionals here in the BBI that are willing and able to help. I think it's important, especially if you have children, because I know it caused a lot of emotional trauma on children as well. So I think that's something that we need to sort out. We have this thing where we think that it's a taboo or something like that if you go to seek some kind of professional help mentally. But I think first of all we need to sort that out before anything else. I think that's one of the key things in getting prepared for this hurricane season. And also, yes, we're going to talk about this next week. I don't know why Natasha wants us to talk about this today. I don't know why. I should just do it next week stuff today. But since you mentioned it, I'll put it in here in terms of if you have a chronic condition. We know that the BBI, we do have a high number of people with chronic diseases. And sadly, a lot of these people with chronic diseases, it is poorly controlled. Okay? So if you're adding the stress from hurricanes on top of a poorly controlled condition, plus we're adding COVID on top of that, that's just, as my grandmother from Montserrat used to say, yards on top of cocoa bean. It's a lot. So we need to make sure that we are prepared. If you have a chronic condition, you need to make sure that food supplies that you have will be able to sustain you. You have your medication and stuff like that, so you're able to, even if you're inside and you can't get out, you'll be sustained for a certain amount of time. And I think I'll leave it there until next week.
Well, definitely next week we'll be back to pick their brains. We might have a whole new panel. You know, you never know what to expect here on Health Bytes, but do expect that we're going to keep you updated, informed, and educated about health matters. Thank you for tuning into the program. I've been your host, Natasha Lettsome, Public Health Communications Specialist.